Greetings. For this assignment, I will be talking about in the technology section. I will give a brief recap of telehealth. In the health systems, we are going to look at how we can rectify, growing shortage in nursing. And in trend section, we are going to look about the persistent mental health issues and substance abuse issues that can be accelerated by the pandemic. So, what exactly is the impact of those trends in our healthcare system from a local level, from a national, or from a global perspective? The world is switching, and post the pandemic, telehealth, telemedicine, televisit has been switching. Even out of the healthcare, people don't even want to go to work. Most people want to work from home. So the issue of telehealth is pushing out there, and a lot of prescribers, especially those in mental health, are utilizing telehealth to see their patients. However, the biggest issue with telehealth is confidentiality and having appropriate equipments. When we are discussing telehealth issues with patients, they might not understand the issues of confidentiality. Us as professionals, we know it. We could be in an environment where it's safer, but they are not, or they might not be because they don't really understand confidentiality and HIPAA as well as other stuff to protect their information like we do. So it is a major health issue that has to be addressed, and people have to be educated, and for that rules need to be put, because it is the world is just changing. It is going to switch to the healthcare issues big time. And then when we talk about disruptions, that's the B part. Due to production, again, during the pandemic, there was serious shortage in distribution by drug companies. I remember working at a hospital in Chicago doing travel nursing at that point, and we were short of Ativan. There was no Ativan nationwide, and I remember we had to start using multi-vial Ativans just because there was no Ativan nationwide, and it was a vast shortage. Production was low. Buses and truckers were low. People were not going to work, but hospitals were still being filled by patients, and it was serious out there. It was just serious, and there was shortage in nursing. Again, the field of nursing is always short. Every day we go out there, we don't have enough people to work with. I think the state and the government, they need to either implement incentive programs from elementary through middle and high school to start gearing younger generation towards the healthcare need, because the current projection by 2050 will not be looking good in the healthcare sectors. And I think the government needs to look for ways to address these needs by bringing things into the academic system that will help to direct the younger generation towards healthcare, especially in the field of nursing. There's just a vast, great shortage in nursing, and with shortage, nurse to staff ratio is just a numbers game, and nurse to patient ratio is just a numbers game, and not having enough nurses on the floor to manage your patient ratio is not safe for both the patient and the staff, especially for those of us in mental health. you come across aggressive patients sometimes. So we do need numbers. We need the floors to be properly staffed, and the only way we can solve nursing shortage is either we start implementing programs in schools that would encourage future generation to that direction, or we are just going to impact on bringing nurses overseas. I mean, I used to work for a hospital that was fond of bringing nurses a lot from the Philippines, and they had a program where they would bring nurses from the Philippines. They work here for X amount of months and go back to the Philippines, and then another set of nurses come over. So that is one way we can look at it. And the trend in calls, during the pandemic and other issues, mental health and substance abuse issues kind of increased during the pandemic. Why do I say so? People were uncertain, people were unaware. Nobody knows where the world was heading to. And a lot of people out here have health issues: bipolar, anxiety, depression, PTSD. So the pandemic did trigger out a lot of symptoms. People were losing their family members, people were not working, the world was unstable, nobody knew what was going on. And the rate of mental health just went up, it skyrocketed big time. I mean, being in a psych hospital, admission rates were just alarming, anxiety cases were skyrocketing. And again, as nurses, we are the ones who could sit there and handle this situation. And with the demand and all that stuff, the cost, healthcare is based on the iron triangle. And the iron triangle is access, quality, and cost. And in order for us to be able to provide adequate care with the shortage that we have now, it really requires healthcare bills are going to go up also. So we need so the government, both the local level, community level, or global level, they need to create ways to minimize cost. Because with the high cost in healthcare, people with adequate healthcare coverages, aka insurances, will not have access to quality care, and some people in the remote areas will not have the interest in seeking care. And when those people don't, the issues of mental health and other comorbidities just increases. So education, creating awareness, and reaching out at the local community level to help the population is very fundamental. Thank you.